Ladies and gentlemen, welcome back to the Jibawi Brothers Podcast, episode 4. My name is Dr. Ray J. On the other side, I got my brother, Dr. Rem J. What's up, bud?
What's up, my man?
How you been?
I'm okay, man. A little stressed out for you.
Why?
No barbers. You can't get a nice haircut.
I see. I get it.
I love your haircut.
Is that what we're doing now? Oh, I got you. I'll hit you with another one.
Okay, we'll take care of it later.
Today's topic is I am stressed out. Patients have been stressed
Everybody's
out.
stressed out, man.
I know. The stress.
It's getting.
We're gonna have to figure out a way to help our patients deal with the stress, man. Tell me a little bit. What do you think about this whole stressful situation with our patients?
There's so many factors that are involved in this. You know, money. Can't leave the house.
Yep.
Can't travel. Can't visit people you love. You know, I think one of the most stressful things people are dealing with right now is that imagine going to the hospital and you can't go see your significant other, you can't see your dad, you can't see your son. It's very stressful. I have a friend right now that went to her OBGYN to get an ultrasound, and her husband couldn't go with her. It's hard, man. Like, so they're missing out on a lot of things in life, and it's been hard.
Absolutely. You have loved ones who's hospitalized for other chronic conditions and other problems, and you're unable to see them.
And they don't even have COVID-19.
I know. And I had a friend of mine who her father died recently, and it was almost impossible for her to go see her father in the hospital, and it was extremely sad. But that's what we're going to talk about to kind of figure out how to deal and cope with the stress.
Like, hey, let me ask you a question.
Tell me.
What can people around our patients are a little bit older.
Yep.
What can people, their family, the community, the doctors do for the patients to kind of cut down on the stress and the depression and all of that?
Well, with all the available technology and these platforms that we use these days, you don't necessarily always have to go and physically touch your family member and see them. You could do, the FaceTime. You can do through mail, through text messages, phone calls, and make it a routine thing, right? Maybe before all of this, you used to call your mom once a week. Well, you know what? Call her every day. Maybe she's going through a lot, right?
Your workout partners, what do? We call Zoom. All of us get on the Zoom. And
all
we do
our boys,
exercise.
all our friends on the south in Miami. We Zoom. We call each other. We do workouts together. We keep ourselves motivated and push each other.
Still continue to do these things.
Positive attitude. Another thing that is a big concern also is we have a lot of patients who already have a lot of mental health issues, depression, etc. That this kind of actually exacerbates their symptoms.
Yeah.
Patients who live in long-term care facilities, ALFs, who already barely see any people or any visitors.
And no family members to visit.
Family members are not allowed to go and see them. It's heartbreaking. So that's why I'm telling our patients, that's why I'm telling our friends, our colleagues, reach out to your family members. Make sure they're okay. Make sure they have everything that they need. Another thing that we need to also stress to kind of decrease the patient's depression and their anxiety is to make sure that they have enough equipment, medications to last them. Throughout this
That's
whole
what
process.
we covered on episode 1.
Yeah, remember that? So if patients on oxygen, make sure they have enough oxygen. If patients on chronic Foley catheters, patients with prostate issues or bladder issues, make sure you have enough of that. Enough
Prepare
medication.
yourself so that the stress doesn't get worse, right? Because if you already have stress and you're not prepared, it just gets worse.
Yep.
The anxiety builds and kind of keeps getting worse and worse.
Absolutely. And make sure that if you are sick, stay at home. You don't have to go and visit your family members, even if you can. Okay?
There's just so many things that you can do to help also, and we keep talking about this, prevent. Don't worry about getting COVID. Don't worry about when the depression kicks. Try to prevent the depression. Try to exercise. Try to, FaceTime your family members. Try to, have a great diet. Because all of these are factors in this. Also, we went back to talking to your primary care. Maybe one of the medications is affecting it. Maybe your thyroid function is off. There's a lot of factors that come.
But you know what the problem also, MJ, is that we don't take into consideration is that a lot of providers or doctors have their patients who come in who kind of down, kind of depressed. Oh, it's age related. Oh, because of their age, their chronic disabilities. Well, they still need treatment. They still need maybe some positive reinforcement, some hugs, virtual hugs, or messages to make them feel better, jokes. At the same time, if you are feeling stressed out and depressed, make your day busy. I always tell my patients to write a schedule for the week.
Yep.
What you're going to do every day, what you're going to cook every day, what type of exercises are you going to do, who are you going to talk to, set a schedule.
Put a little notebook next to your bed.
Exactly,
I do that.
Exactly.
Oh man, tomorrow morning I want to do this. So I write it down.
And you add it. Absolutely. Now for our healthcare providers, the doctors and nurse practitioners, physician assistants, make sure in order to decrease the stress for the patient, for example, if there's patients that have chronic conditions who need to follow up with their specialists, cardiologists, orthopedics, etc., referrals. Make sure they're ready for the patient, all set, where they don't have to stress about calling, oh, where's my referral? Did I get authorization, etc.
There's a lot of things we can do, even just answering the phone.
Yep.
You know, when you answer a phone, there's a difference between yes, hello, what do you need, versus hey, good afternoon, how are you? You know, Mr. Smith, I missed you. It's been such a long time.
Yep.
Give them something that made them think that you paid attention to them when they were in your office.
Yes.
How was your granddaughter?
It makes a big difference.
Exactly.
It does make a difference. And we also need to reach out to the community. The community.
That's why we're doing this.
We're
doing it for you guys to make sure that you guys know that we're here for you.
Our services are there's not enough services due to this COVID-19 pandemic. So I think that a lot of these community leaders and centers need to sit down, figure out a way to reach out to their members, figure out to reach out to the people in the community, how to make it better. You don't always necessarily physically have to be there, but virtual. We could do a lot of virtual activities.
We're doing everything. Virtual goes such a long way, man.
Absolutely. So to summarize our topic today, I think the most important thing is a simple smile, happy text messages, mail in some cards if you don't know how. Have a positive attitude and set a schedule for yourself. Once we get out of our daily routine, I think it kind of makes us a little bit more depressed and stressed out.
Also, watching TV. Don't wake up in the morning and watch news all day about negative. These are things that you can't control.
Especially
Spend more
our
time
geriatric.
exercising.
Exactly. Our geriatric population. All you hear on the news is, typically patients over the age of 60 are more prone.
It's freaking them out.
So of course they're going to stress out. They already have multiple chronic complications, so they're stressed out about it. So stop watching the news. Okay, understand.
Educate yourself.
Go to the CDC.
Not all day watching
website. Figure out, learn more about the virus. Absolutely.
Instead of spending all that time on focusing on the news, focus on how can I eat healthier, right?
Exactly.
How can I get more sleep at night?
Absolutely.
Because guess what? If I'm watching the news and that news made me stressed and now I'm not sleeping, guess what? It's like a domino effect.
Yeah, it is.
So you're not sleeping, so anxiety builds. When anxiety builds, depression builds, and it continues until you stop it. How do you stop it? You eat healthy, you avoid the stressors, avoid watching TV with negativity. Don't contact people that are going to give you negative, when you call somebody, you feel that negativity, don't call that person. Call the people that are going to make you feel good. Somebody that's going to give you something positive. Positive reinforcement, it goes a long way.
Absolutely.
We have to stick with each other, help each other. If there's something that I can educate my patient on and help them, I'm going to give it to them. And this is the whole point of this podcast, is that I want to give all the knowledge I have, everything that I do on a daily that helps me prevent my stress. I want to give it to my patients.
Absolutely. That's the best way, man. And that's why,
Some patients don't have family members. And this is something I wanted to talk about last podcast, AJ. If somebody does not have a family member and, is alone, let us know. More than happy to sing for them. I can't sing very good, but I'm more than happy to sing for them, dance for them, whatever they need. Show them some exercises.
I'm ready to sing a tune, man. Let's do it.
So, ain't no mountain high.
Ain't no valley low.
Ain't no river wide enough, baby.
If you need me, call me.
You know the number, AJ.
What's the number again? No, I'm just joking. 727-777-5522. Thank you so much again, ladies and gentlemen. The Jibawi Brothers Podcast. We'll see you on the next episode. God bless, stay safe, and decrease your stress levels, please.
Thank you, guys. You know what to get me for my birthday next year. Some singing lessons. I need it. Take care, guys. Have a good one.